Our time is 8:06. A growing measles outbreak is sounding alarms across the nation with over 1,000 reported cases spanning 31 states. Last week, a single infected traveler at Newark Airport potentially exposed thousands of travelers, while cases in Dallas raised concerns about further spread through major travel hubs. We're joined by Dr. Steve Goldberg, Chief Medical Officer at HealthTrackRx and a leading voice in infectious disease prevention, to discuss the dangers of measles, how the disease spreads, and what you need to know to stay safe. Welcome, Dr. Goldberg. Thank you for coming on this morning.
Ken, good morning. Good to be with you.
Thank you, sir. First, let me ask you this, because I know I had this conversation with my doc for myself, because I'm going to be doing a lot of travel over the summer. Can your measles vaccine weaken over time? Because I had it as a kid. I had not measles, but the vaccine. Is there a point when you need to talk to your doctor and say, do I need to get my shot again?
Yes. So if you have doubt, the CDC recommends getting at least one MMR vaccination. If you want, you can also get a lab test to check your immunity. And there are certain profiles of adults where they're more likely to be at risk. If you only had one MMR dose in the distant past in the 1960s, if you got something called the killed virus vaccine, or if you're unsure of your immunity and were born after 1957, about that era, those are times where you should be thinking about your immunity.
You just described me to a T. I'm born 1967. I had the inactive one. So, yeah, so it looks like because I've had hepatitis shots in the past as well. And my doctor said that, no, it looks like you've worn off, whatever. I'm in the middle of getting a double dose shot right now for that because I'm traveling in a few weeks. So, yeah, it's important to get those vaccines. People, I think, do not think about that, especially if you're going to travel overseas. People don't give that thought. You really need to know. And even as we know, in the case of measles, traveling domestically. So we have over 1,000 measles cases reported across 31 states. Is that considered a serious outbreak? And why is measles such a dangerous disease, doctor?
Ken, it is a serious outbreak. And a couple things. Let's put it all into context. Back before 1960, when we put forward measles immunization, we would have about 3 to 4 million children affected annually. And that resulted in about 48,000 hospitalizations, and about 400 to 500 deaths per year. So think we've gone from that to 1,000, which is bad. But there was a time back in 2000 that we felt we had been cleared of any risk of measles. So the fact it's resurging, and knowing the terrible history of measles in the past and the tremendous success from immunizations, creates all public health and population health folks to be very concerned. Yeah.
And we've heard about this one case at Newark Airport potentially exposing thousands. That's the thing. All you need is one person who has the disease, who could touch, cough, whatever, and then you have 10,000 people follow that person, and potentially they could all become infected. It's just terrifying to think about that. That's the way infectious disease happens. And in Dallas, a major travel hub, you have a circumstance where sometimes you have religious communities who don't want the vaccine. And we understand, look, we have religious freedom in the country, so we don't want to besmirch anyone. But the problem is, when you don't have the immunity, that's how it spreads like that. So how easily does measles spread in crowded places, and what does that mean for travelers this summer?
Yeah, Ken, let me put it into context. I mean, when we have nationwide control of measles, what that roughly means is that 95% of folks in a given community have active immunity. And what happens is, as that number drops to say 90%, because measles spreads so easily, there's risk of the transmission. So I know you described the Newark event. It really depends on whether that infected person was around a population of 95% of folks who are immunized or lower, to put that event into context.
Gotcha. That makes sense. So if you have your vaccine, not that you're entirely out of the woods, right? But the chances are you are pretty much protected. So that if you had your vaccine and you passed by and touched stuff that they touched, chances are you're pretty much good. But that's why it's so important to make sure your
Absolutely,
vaccine is up to
absolutely.
date.
Yeah,
But
and to
I
your
love,
point,
yeah. Yes, sir.
We're concerned about communities where that 95% number is lower, right? And that's where an infected person comes into the environment. And given how easily measles spreads, it can spread among that group.
That's yeah, that's so essential, and that's frightening. You know what? Give us the symptoms. I think people have heard measles, but because it's basically for years we considered it somewhat eradicated in this country, but not so much now. Um, Tell us what the symptoms are and why it's so dangerous. I think a lot of people mix up measles and chickenpox, very different diseases. So please tell us about measles.
Yeah, measles is a illness that has certain ways of presenting. In general, people don't feel well. They have a fever. They have a rash, a certain type of rash, and they also most commonly have respiratory symptoms. Small percentage also can have encephalitic or brain inflammation symptoms. So the primary symptoms are a fever and a rash. Yeah.
And is the measles vaccine, is that one of the required vaccines for kids before they go into school, or is it just a state by state thing?
Well, it's actually mandated by Congress, right?
Mhm.
Uh, that children should be immunized, and there are different state uh, legislative adjustments, right, that are occurring to give people some individual discretion with regard to immunity. But in general, children are immunized very early when they're entering school.
Right. And I remember I just had the conversation with my niece who had a baby when the baby was getting the MMR vaccine and how important it is to make sure you have it. I am definitely going to make sure that I get a booster before I head overseas in the next few weeks. Just because I know it takes a few weeks for the vaccine immunity to build up in your system too, right?
Yes, it does, and that's why in general it's a two vaccine
Mhm.
process to get someone protected. Yeah.
Okay. And given your expertise at HealthTrackRx with large-scale pathogen surveillance, are there steps that public health officials and individuals need to take to contain the outbreak now to prevent further spread beyond the 1,000 that we know of?
Well, I mean, in general, we want to track immunization rates and we want to track outbreak events. And the way our company contributes is we have the ability to support very rapid diagnosis of someone who is presenting with the symptoms, and that can help uh, population control events, and it can also help that person get into best supportive care, and
Tell
also,
us
frankly,
how does
isolation.
your, I'm sorry, I didn't mean to step on you, doctor. Tell us how the company does that, because that sounds fascinating.
Right. We are a company that offers infectious disease testing in the outpatient setting. There are different ways to look for infectious disease organisms. We use a particular type of test as a category. It's called a molecular test. So you're looking at the DNA or RNA, and specifically the genes in the bug uh, when we're looking for an organism. So it's highly sensitive and specific. That means you're good at identifying negatives and positives. And we have a process with a partnership with UPS that allows us to result out infectious evaluation across multiple different body symptoms the next morning.
That's fascinating. I love that. And what a, we've come so far. The technology is so amazing how far in advanced it is. We have these cases continuing to rise, doctor. What do you think for the summer, as long as communities work together, as long as public health offices are in communication, do you think we could bring the measles disease outbreak right now that we have under control?
Well, Ken, I think the reason we're having this measles outbreak at all is because of vaccine hesitancy.
Mhm.
So people have heard different information about the safety of measles, mumps, rubella, measles vaccination, and they're pausing. Um, Measles is a very safe vaccination. It's been safe for 7 decades. right? And so I think what we need to do as concerned clinicians, public health, population health individuals is make sure people understand that they're safe, be available to empathetically listen to their concerns, and help them bridge that gap to get them comfortable to make sure their children are immunized and they themselves are immunized.
So important. Talk to your doctor. Talk to your doctor. Get this. I mean, we're talking about, think about the concerns of and hesitancy for some of getting a vaccine versus what happens if the population all gets measles. That's a lot worse than worrying about a vaccine. So talk to your doctor. This vaccine, as the doctor just said, has been around for decades. Get your vaccine. Very important for your sake, your family's sake, and the community at large. Dr. Steve Goldberg, Chief Medical Officer at HealthTrackRx, please come back again. Thank you so much for this important information and for joining us this morning, sir.
Our pleasure, Ken. Have a great day.
You as well, sir. Thank you.